Hello, and welcome to our presentation entitled Referral Programs to Reduce Your Patient's Risk for Chronic Disease. My name is Jessica Downs, and I'm a nurse consultant with the Section of Chronic Disease Prevention in the Department of Health. I'm also a member of the Take Heart Alaska and Diabetes Coalition. I'm here to talk to you today about the low and no-cost chronic disease prevention programs endorsed by this coalition and by the state of Alaska's Department of Health. These are evidence-based programs proven to create lasting results for your patients and our communities. Thanks to a grant from the CDC, many of these programs are available at no cost, completely free for your patients. The goal of the presentation is to discuss 3 programs specifically aimed at helping you, the provider, to empower your patients to achieve wellness and prevent chronic disease. The presentation is specifically aimed to assist you to empower patients with prediabetes and obesity, type 1 or type 2 diabetes, and hypertension. We know that chronic disease is a public health crisis. The data in this slide is from 2020. As you can see, it tells us that 69% of Americans are overweight, 46% have hypertension, and 35% are prediabetic. While we're waiting on newer data, we can say with some certainty that these numbers are likely much higher now. One study in the Journal of the American Medical Association shows that Americans were gaining about 1.5 pounds per month in 2020. Nearly a year later, the CDC published data showing that about half of all Americans, about 42%, had gained an average of 29 pounds, and 10% had gained more than 50 pounds. We also know that 35% of adults in the United States have prediabetes, and 5 to 10% of those with prediabetes will go on to develop type 2 diabetes every year. To address this crisis, a wide range of medical agencies have backed 3 very specific programs as medical best practice. For prediabetes, the National Diabetes Prevention Program, or DPP, has strong proven success. The Diabetes Self-Management Education and Support Program, or DSMES, has proven outcomes for folks with diabetes of both types. And hypertension is shown to be well improved by the Self-Measured Blood Pressure Monitoring Program. Why do these programs work? They work because they're built off of what we know is successful: gradual weight loss, calorie reduction, and increased physical activity. This is not new science and has been shown to be the most successful across all disease types. We call these programs lifestyle change programs. The National DPP Evaluation Study has validated this approach. This study looked at folks with prediabetes and obesity. The study, which just completed a 15-year retrospective review, found that lifestyle change programs are more effective than metformin in both weight loss and prevention of diabetes. As we know, weight loss is a game changer. This data shows that weight loss of as little as 10% can reduce a person's chance of developing diabetes by 85%. Metformin cannot compete with these results. The National Diabetes Prevention Program was first introduced in 2010 by the CDC. The goal of the program is to reduce the incidence of type 2 diabetes. The Diabetes Self-Management Education and Support, or DSMES program, improves health outcomes for your patients with diabetes. When they participate in DSMES, your patients will learn how to manage their blood glucose, cholesterol, and blood pressure, along with other key lifestyle self-management habits. Lastly, the Self-Monitor Blood Pressure Program, or SMBP, is another coach-led chronic disease prevention program. Participants are taught how to check their blood pressure at home and are trained on proper techniques, including sitting still, resting their arm on the table, no recent coffee, cigarettes, and similar. The National Diabetes Prevention Program, or NDPP, as discussed, was first introduced in 2010 by the CDC. The goal of the program was to reduce the incidence of type 2 diabetes. As participants progress through a 1-year journey, they learn how to incorporate physical activity into their daily routine, how to choose healthier foods, and practice coping skills for healthier stress management. Weight loss is used as the key measure of success in the program, as we have shown that by losing 5% of your body weight, you can lower your risk of type 2 diabetes by 58%. The contents of a DPP program vary very little. Participants will meet with their lifestyle coach once a week for the first 16 weeks, and then once a month after that for the remainder of the year. They're asked to complete 150 minutes of physical activity and to keep a food journal. There are several ways that individuals can access the DPP. Some DPPs use a cohort model where individuals meet in a group with other enrolled DPP members. Some programs use one-on-one meetings. Some programs meet solely in person, while other programs meet at a combination of in-person and online. and still other programs are completely distance delivered. With all formats, there's flexibility. The coach's goal is to create a collaborative relationship with the participants. And while the structure can be set, there's room for flexibility within that structure to assure that the program remains patient-centered and outcomes-driven. As I mentioned, the DPP is delivered across Alaska in a variety of ways. For online delivery, the state of Alaska has a contract with a company called Omada Health. Omada delivers the DPP completely online through their app, and participants can complete the curriculum at their own pace. They'll meet with their coach through chat or email in the app, and they'll have the ability to chat with other members in their cohort. Omada works hard to group participants together in their cohorts by region. In addition, individuals who join will receive a free Bluetooth scale in the mail. The scale will link directly to the app, so the data on their weight and on their participation will be shared with their coach in real time. To enroll in this program, patients will need to visit omadahealth.com/Alaska. For telephonic delivery, the DPP is available in Alaska through another vendor called Inquisit Health. Landlines or cell phones both work. The participant will receive their curriculum in the mail, and they'll meet with their coach over the phone. One of the great things about Inquisit is that we've had this relationship for so long that there are several participants who have graduated from Inquisit in Alaska and have come back to be coaches for the program. This means that your coach is a local Alaskan. Inquisit participants also receive a free scale in the mail. To enroll in this program, your participant can either text the word health to 600-400 or call the number on the screen and speak directly with our enrollment specialist. Finally, there are also several in-person DPPs in several locations across the state. Each one delivers DPP slightly differently. Some are completely in person, some use platforms like Zoom to offer a hybrid version, others use a platform like Halt to combine the flexibility of online programs with the in-person approach. The list of DPPs is constantly changing, and if you do not see your program on this list, or you do not see one in your community and you'd like to start one, please feel free to reach out to the State of Alaska's diabetes program at diabetes@alaska.gov. Next, let's take a closer look at the Diabetes Self-Management Education and Support Program, DSMES. Diabetes Self-Management Education and Support improves health outcomes for your patients with diabetes. When they participate in DSMES, your patients will learn how to manage their blood glucose, cholesterol, and blood pressure, along with other key self-management habits. Referring your patients to DSMES can also help you meet your follow-up care guidelines. Your patients will work with a certified diabetes care and education specialist. This licensed health professional will provide you training, counseling, and follow-up activities to your patients to support your plan of care. There are several ways to access DSMES across the state. With all formats, there's flexibility. Again, the coach's goal is to create a collaborative relationship with the participant. While the structure can be set, there's room for flexibility within the structure to assure that the program is patient-centered and outcomes-driven. Studies have found that individuals who attend ongoing DSMES are more likely to use primary care and preventative services and follow up with treatment recommendations. DSMES attendance is also associated with improved self-care behaviors, lower A1C, lower blood pressure, lower cholesterol levels, lower self-reported weight, improved healthy coping mechanisms, improved medication adherence, improved quality of life, reduced hospital admissions and readmissions, and reduced healthcare costs. It is also important to note that outcomes associated with DSMES services have been shown to be dose responsive, as the more DSMES leads to better outcomes. It can be helpful to look at the benefits of rating DSMES education with the parameters utilized to evaluate a medication. Despite the well-documented benefits and the reimbursement for this service, reports indicate that only between 5 and 7% of individuals who are eligible for DSMES, either through Medicaid or private insurance, actually receive it. The DSMES is available in a couple of different ways. For online delivery, the state of Alaska has a contract with a company called Omada Health. Omada delivers diabetes self-management completely online or through their app. Participants can complete the curriculum at home at their own pace. They'll meet with their coach either through chat or email within the app. Their coach is a certified diabetes care and education specialist. They will also have a chance to chat with other members of their cohort. And as mentioned, Omada works to clump participants into cohorts of regionally similar participants. The last thing to know is that the program offers individuals who join a free Bluetooth glucometer and strips, as well as scale in the mail. Some folks may also receive a CGM, though not all folks will. The determination for a CGM is made at the discretion of the diabetes care and education specialist health coach. These peripherals will all link directly to the app, so data on both weight and participation will be shared with the coach in real time. To enroll your patients, visit omadahealth.com/Alaska. DSMES is also available in multiple locations across the state. The state of Alaska has an umbrella license to help remove the accreditation barriers from DSMES delivery sites. For the most part, in-person DSMES programs are delivered in clinical settings. Again, the list of DSMES sites is constantly changing as more programs join. If you don't see a program in your community, or if you'd like to start one in your community, please feel free to reach out to the state of Alaska's diabetes program at diabetes@alaska.gov. Lastly, let's take a look at the blood pressure self-management program. As with DPP and DSMES, SMBP is delivered in a variety of manners across the state. SMBP is another coach-led chronic disease prevention program. The program aims at teaching participants about blood pressure and how their diet, lifestyle, stresses, and similar factors all impact blood pressure. Programs vary in length, but average around 4 months, and participants are taught how to check their blood pressure at home and are trained on the proper techniques, including sitting still, arm resting on the table, no recent coffee, cigarettes, and similar. They're also taught about salt and other dietary influences on blood pressure, as well as other topics that empower the patient to work in partnership with their provider to manage their hypertension. For online delivery, the state of Alaska has a contract with a company called Omada. Omada delivers the blood pressure self-management program completely online or through their app, and participants can complete the curriculum during the week at their own pace. They'll also meet through chat with their coach on the app. The coach is specifically trained in blood pressure management, and they'll have a chance to chat with other members of their cohort as well. As mentioned before, Omada works with the state of Alaska to regionally clump participants into cohorts of other participants in regionally similar locations. Individuals who enroll in the program will receive a free Bluetooth cuff in the mail. This peripheral will link directly with the app so that results and participation can be seen by their coach in real time. If you have a patient who would like to enroll, visit omadahealth.com/Alaska. SMBP programs of all types are delivered across the state in person. SMBP is the least prescriptive of all the programs. Because of this, each program is highly adaptable to fit the needs of the community in which it resides. Some of our programs are embedded in clinical settings, some are in community groups like craft nights and libraries, and others are delivered through community-based organizations. The list of SMBP sites is changing as more sites join. If you don't see your program on the list, feel free to reach out to the state of Alaska at heart@alaska.gov. So in review, in addition to being delivered in person, the DPP, DSMES, and SMBP programs are delivered in a variety of distance-delivered formats at no cost to make access more available to all Alaskans, regardless of their geography or internet type. When you speak with your patients about Omada, there's one important heads up. The very first page that your patients will fill out is an intake screening form that will ask about insurance. Don't let this be a deterrent. The question about employers and about insurance is just to help the state of Alaska make sure that patients' employers that cover Omada will cover the cost for that patient's enrollment. If their employer does not cover Omada, the state will cover the cost. Either way, there is no cost to the patient for Omada. This just helps us assure that our grant dollars go further and especially reaches out to those who need the no-cost service the most. Encourage your patients to click from the drop-down menus or simply check none if they do not have coverage. Inclusion criteria into these programs is pretty basic. Patients with obesity and one complicating factor such as hypertension or tobacco use will qualify for the DPP. Patients with hypertension who are over 18 qualify for SMBP. And anybody over 18 with type 1 or 2 diabetes qualifies for DSMES. There's some exclusionary criteria, such as folks who are pregnant cannot enroll in the DPP, or folks with a recent cardiac event do not qualify for SMBP. However, each program has enrollment and screening forms that will assist in screening the candidate in or out of the program as is appropriate. We see the most successful referrals into these programs with providers who follow the Ask Advise Connect model, or AAC. Using this model and some team-based care, clinical teams work to actively connect the patient to the appropriate program. For online programs, you can help your patient complete the enrollment at omadahealth.com/Alaska. For telephonic programs, you can have them text the word health to 600-400 from their mobile phone or call the number listed here to speak directly with our referral specialist. Each program encourages their participants to maintain a strong and collaborative relationship with their provider. Some of the in-person programs, such as the YMCA, will actually mail you a letter letting you know how your participant is doing as they achieve certain milestones. With the online program, there is a mechanism for your patient to directly email you their outcomes. Your patient will need an email address for your office and can set up a recurring email to be sent from them to that email address in the app. It may take some partnership and collaboration with your patients as an equal team member to continue reporting back their successes and progress. Team-based approaches to care can help distribute this work. The state of Alaska is working on a few collaborative referral systems that will hopefully allow for referrals directly from your EMR. If you would like to learn more, feel free to email diabetes@alaska.gov or heart@alaska.gov. Access to care and patient empowerment are the key factors to health equity and cultural tailoring. We recognize that not every person has the same access to care. For some, in-person is the best option. For others, programs that they can do at home, like the telephonic or web-based programs, are the best option. We work hard to create what we call a no wrong door policy. We want to identify access barriers and work with regions, clinics, and statewide distance programs to overcome these barriers. Each of these programs works to empower the patient to become an equal partner and an owner in their wellness journey. We believe that teaching patients is more powerful and more sustainable than simple medical interventions alone. These programs all work in collaboration and partnership with the medical system to empower patients to understand their health and create long-lasting change. There are many tools available to assist providers in linking patients with the resources to achieve their wellness goals in the midst of chronic disease. Look for the links attached to this video. To learn more about these programs mentioned in the video or about the Take Heart and Diabetes Joint Coalition, feel free to contact the state of Alaska at any of these email addresses. Thank you very much for your time. Please feel free to reach out with any questions.